One of the hottest moments of your life, and there's no one to properly explain what happened to your arm. Well, folks, it's not uncommon at all. In fact, it's extremely frequent for a patient with a brachial plexus injury to find out what happened, sometimes by watching a YouTube video. Unfortunately, doctors, even specialists, don't have much experience with this type of injury. So when a patient has a motorcycle accident, they get to the hospital, then they treat the fracture, the arm, the lungs, the head. However, no one can explain why the arm isn't moving. If you've been through this, tell me in the comments. I want to hear your story. So let's reflect. You're going through one of the most complicated moments of your life, and you don't have someone to guide you on this path saying, your injury happened this way, we're going to do this, we'll order this test, and we'll do physical therapy up to a certain point. From there, you'll need surgery. This only happens when you find a qualified specialist to help you. So if you feel insecure, if you don't know where to go, if you have doubts, maybe you're not with the right doctor or physical therapist, a plexus injury needs to be recognized through diagnosis, which in reality is just doing a physical exam where you'll notice the injury. And to understand if it needs surgery or not, and the level of severity, some tests are ordered, like a brachial plexus MRI and electromyography. After doing these tests, you need to have a plan, meaning is the injury severe, mild or moderate, will the shoulder likely not improve or will it? Is the hand improving and will it become a nerve donor for the shoulder, for the arm or not? If you don't have these answers, maybe you're not with the right specialist again. In other words, we have a diagnosis, we did the necessary tests, we understand the severity of the injury, and now we have a plan. All of this leads you to have the best result that your injury allows. You can watch videos here on the channel where we explain hand injuries, C5, C6 injuries, which affect the shoulder and biceps, and understand the expectations for improvement. However, if you don't know what your injury is, what's the point of knowing the final result? It's impossible. You can't. So, this video is to tell you one thing. If you have doubts and don't have a treatment plan laid out, seek a peripheral nerve specialist. You won't regret it a few years from now. Maybe you want to deny the injury now. You might just want to think you'll get better on your own. However, when time passes and you don't improve, you regret what you didn't do in the end. I don't have any patients who regretted seeking help initially. So if you're that patient who's in doubt, seek help. If you like this video and want more information about brachial plexus injuries, don't forget to like this video and follow our channel.